Hello and welcome everyone. This is Luke Herbert, pharmacist at KSB Hospital, and with me today is Gabe Billiet, pharmacist at KSB Hospital. Hello, Gabe.
Hi there, Luke.
Glad to have you here, and thank you to KSB Community Wellness for arranging this event. And with that, we'll get into it. So we're here today to talk a little bit about drug allergies and side effects, and kind of what's the difference, why is this important. So it's something we encounter as pharmacists on a pretty regular basis, and we're going to try to share with you why that matters and why it's a good idea to just have a good record, I think, in a nutshell of your allergy. So Gabe, what is an allergic reaction to a drug?
Sure. A drug allergy is an abnormal reaction of your immune system to a medication. Any medication, over the counter, prescription, or herbal, is capable of producing a drug allergy. However, a drug allergy is, more common with certain medications.
Perfect. And when somebody has an allergy to a drug, a lot of times we think of it as that family of drugs or class of drugs, which isn't always the case. But typically for an antibiotic, if you're allergic to a penicillin, then we consider that you may have an allergic reaction to any of the antibiotics in the penicillin class, correct?
That is correct.
And then we'll switch gears a little bit. What is a side effect from a medication?
Side effect is basically any unwanted or unintended effect caused by a medication. It is usually consistent among a whole group of people, so it's something that we would expect, a wide range of people to encounter and to have.
Sure. So there's rare side effects. There's relatively common side effects to certain medications. And, one of the fundamental differences is a side effect isn't your immune system reacting to that chemical or that drug. And so we don't need to be concerned about an anaphylactic reaction. So that's one of the main thing we worry about with allergies. If you've had a history of a mild or moderate reaction, there's a chance that the next time we expose you to that medication or a related medication that you have a more severe reaction. And that's, the main thing that we're really worried about. With a side effect, you can certainly have that side effect again, but if we know about it, we can kind of weigh the risks and the benefits. And maybe, if it's nausea, we can give you something for nausea, or we can make some suggestions to minimize that, but it's not necessarily going to be dangerous. So I might have jumped the gun a little bit there, Gabe, but why does it matter? Why does it matter as far as allergies or side effects? And I guess what's the risk of labeling? If you had a history of nausea from a pain medication, or fatigue or tiredness from a medication, and so you put that on your allergy list, and then you go to the office and your nurse asks you what you're allergic to, and you list all those things. What's the risk there?
Well, the risk is anytime that we want to treat any health condition, we want to treat with the most effective medication possible. And when we have a list of allergies on a profile, we will start to exclude those, from our list of choices. Now, if it's truly an allergy, we want to avoid those. We want to avoid similar medications. If it's not an allergy, then we are skipping over what can sometimes be our first, second, and even third choices, and going with our fourth, fifth, and even sixth choices to try to manage a condition. And we're not going to be able to manage it quite as well as we would with some of those, first line choices.
Absolutely. So if you have a long list and it's a little bit unclear, side effects, allergies, your provider's kind of forced to go, as Gabe said, to maybe a third option or a fourth option, and that could mean that the prescription's a lot more expensive, or it could mean that you're going to take an antibiotic or a medicine that maybe has more risk of other side effects or side effects, and maybe just a risk that it won't work as well. So it's just good that we have as much information as we can with regard to that allergy list. So and I think we want to I think it's good to know if you've had side effects or serious side effects to medications. It's okay for us that to be on the list. We just would want some clarity around that. So we'll get to how to manage it, allergies, but So it's good to include all that, but I think with as much detail as possible, I think is what we're getting to. So, with that, we can talk a little bit about, how are allergies managed, I guess, on the part of providers and pharmacists.
Yep. From a provider standpoint, we want to treat the immune response that's happening. That is the hallmark of an allergy, is it's the body's, abnormal immune response to it. So we would take medications to help kind of back off of that immune response, such as antihistamines, or steroids, both of which do carry their own side effects, with their usage. Versus if it was just a side effect, we can then manage, the effect of that medication. Say it was, upset stomach, we can back off on the dose a little bit, start with a little bit of a lower dose, like a pain medication, or we can have a patient take it with food. Side effects, since they're not handled by the immune system, we can manage without resorting, to things that have to work with the immune system that way.
Yeah, perfect. So the first thing we're going to do, probably, if you have an allergy or we think you might have an allergy to a medication, we'll probably just avoid that med in the class of meds in most cases. But if we do know that it was a minor allergy, it was a number of years ago, we may, as Gabe said, be able to prescribe that medication, have you take some, give you some warnings, and have you take some antihistamines and so forth. The side effects will probably, maybe be more selective as far as which med we prescribed for you or used for you. We may lower the dose. As far as allergies go, doses really don't matter for the most part. So we treat those things differently, and so it's good for us just to know specifically whether you're talking about a side effect to a medication or an allergy.
Mm-hmm.
So, and certainly if somebody comes in, a lot of times one of the first questions we're going to ask about allergy is, when did that occur, and can you describe a little bit about it? And so, the kind of question comes up, can allergies, go away with time? Gabe?
Mm-hmm. Allergies certainly can fade over time. As we get older, our immune system is not as proactive about attacking new substances. Case in point is a penicillin allergy. There were studies that showed that for the most part, every year past an allergic reaction to penicillin, it decreases by about 10%. So after a 10 years time period, roughly about 70 to 80% of the population will not mount a response, to penicillin.
Absolutely, and you can take a medication once or twice previously and not have a reaction to it, and then you can develop a reaction to it. So it can go both ways. You can definitely develop an allergic reaction to something that you were not previously allergic to. I think I already answered the other question on here. Severity does matter.
It does.
Severe anaphylactic reaction, we're not going to challenge, but we may try to challenge a more mild reaction if we think it's worth it. So, what should a patient do regarding allergies and side effects? What can patients do about that?
Well, the first thing is to make sure that you and your doctor and your pharmacy are all on the same page together. Make sure that your doctor has your list of drug allergies and intolerances, a list of medications to things that you have not tolerated. And it's important to show what the reaction was, how severe was it, and did it happen repeatedly, with, similar medications.
Absolutely, and so certainly, if you go home and you take an antibiotic, you're taking a medication, and you're having a rash or itching or those kinds of things, tingling, you definitely want to notify your provider, find out if you should stop, change the prescription. Certainly, if it's anything with the airway, we're going to want you to go to the ER, because that can progress pretty quickly.
Yep.
We wouldn't want to have you stay home and try to treat that at home. So,
right.
It's good to know too with antibiotics, like Gabe mentioned earlier. A lot of times we're limited with what antibiotics we can use when you have multiple allergies in particular. So it's also good to know, maybe on that list, what antibiotics you've tolerated well in the past and when that was. So I guess anything else, Gabe, we might add to wrap up today?
If you have a long list of allergies, especially to lots of different types of antibiotics, it might be time to consider maybe seeing a specialist, seeing an allergist who can test you for those specific antibiotics and see if it is still an allergy or if it was an allergy even in the first place.
Perfect. So like we said, keep a list, keep it some detail in there and keep it up to date. And thank you much for your time tonight, Gabe, and your expertise. Appreciate it.
Thanks for having me.
A big thank you to KSB Community Wellness for arranging the program tonight. And everybody have a good night. Thank you.
Take care.